So today's episode, I wanted to take, again, a little bit of a deeper dive into newborn sleep. You know, babies don't come home with a manual. I wish they did. And in our current society where our family structures have gotten smaller and smaller, a lot of us haven't had any experience necessarily with a newborn until we bring home our baby. 100, 200 years ago, you would have been taking care of your aunt's baby, your sister's baby, your cousin's baby, Sally's baby from the farm down the street. And now a lot of us, the first time we're really dealing or thinking about newborn sleep is when we leave the hospital. And so we're kind of learning by trial by fire as opposed to having a lot of that community experience that we would have had traditionally. So kudos to parents, because this is really hard to do, especially when it's the first time you're really experiencing a baby. So the whole point of this episode is to just give you a little bit of information about what's normal for newborn sleep and give you some tips and tricks to lay a great foundation for good sleep habits. And I hope that you find this information empowering and helpful, especially if you're in the thick of it and you're super sleep deprived. And if there's any way that I can be helpful, during this, please leave a comment. I'm happy to answer as many questions as you guys all have.
Welcome to the Beehive Doc Talks with Dr. Blair Rolnick. As a pediatrician and mother herself, Dr. Rolnick is here to answer your most pressing parenting questions and guide you through the tough spots.
All right, good morning. Welcome back to Be Kind Pediatrics. We are going to continue talking about newborns today, and today we're going to focus mostly on newborn sleep. So the topic of today's episode is really meant to give, especially new parents, an idea of what is typical for newborn sleep and things that you can do to really set your newborn up for success. You cannot yet sleep train a newborn child. Really, formal sleep training needs to wait until a child has the cognitive development to be able to self-soothe. So that is usually closer to 4 months, but there are definitely things that you can do in the beginning to set your baby up for success and to naturally develop a good circadian rhythm. So let's start off by talking a little bit about circadian rhythms and sleep and how our brains and specifically babies develop sleep architecture. So all babies and adults spend time in both something called REM and non-REM sleep. REM sleep you can think about as being it's also referred to as rapid eye movement sleep, but for babies what that really looks like is what we call active sleep. And non-REM sleep is what we call quiet sleep. So what does that mean? When we say active sleep, sometimes you can, especially babies, be asleep, but have your eyes open. They can be crying, making noises, even looking around, versus non-REM sleep or quiet sleep, they're more often motionless and quiet. The difference, or the major difference between newborns and older children and even adults, is newborns spend much, much more time in REM sleep, meaning they're spending much more time in this active sleep phase. And for a new parent, or any parent really with a newborn, it can be really challenging to tell the difference between when your baby is actually awake versus when they're in this active form of sleep. As babies' brains develop, they will spend more and more time in non-REM sleep as opposed to REM sleep. The other important thing to note is the average newborn sleeps anywhere from 11 to 17 hours a day, with most babies being closer to that 16 to 17 hours a day. So babies spend a lot of time sleeping. Lastly, it's important to know, how does your brain or baby's brain tell them it's time to go to sleep? When we all get close to nighttime, there is a part of our brain called the pineal gland that's at the top of your brain. And that gland is specifically sensitive to light. So when light stimulation actually starts to decrease, then that gland starts to make a hormone called melatonin, or the sleepy hormone. So the less light that gland gets, the more melatonin that it makes. And this is important. We'll talk about it later, specifically in the sleep architecture of the newborn, because newborn babies have spent thus far their entire life in the uterus, and so they've had no light stimulation yet. And in some babies, they can do what we call reverse day-night sleeping, where they sleep all day and they think that's the nighttime, and then they're up all night. So what does all of this mean? It means a few things. One, that your baby needs time to develop and learn how to sleep. Two, some babies will seem like they're awake, but they're actually in this active form of sleep and not actually awake, but yet sleeping. And 3, sometimes they can get these all mixed up and they need a little help along the way. So what are some of the things you can do along the way to set your baby up for success? First of all, let's talk about light. As I said before, having a lot of light stimulation will reduce melatonin production. Having too much, having not light stimulation will increase melatonin production. So the first thing you can do is actually keep your newborn's room dark at night. And this is true for children as well as adults. You want to be able to not see your hand in front of your face when the windows are shut and the lights are off. So if you can see your hand in front of your face, that is a sign that there's probably too much light stimulation in the room for your newborn. 2, you might consider during daytime naps, and especially during daytime hours when they're not napping, having them exposed to the light. So windows open, get them outdoors if the weather is great, and have them have some natural daytime light exposure to help them develop a natural and tuned circadian rhythm. This is especially important if you start to notice that your newborn is what we call reverse cycling, so that they are sleeping long hours during the day and then awake all night. Naturally, babies should start to they spend about 30 to 45 minutes in a REM cycle, which means they spend about 30, 45 minutes sleeping and then they wake up. As they mature, they will start to connect those REM cycles. So you will start to see potentially each length of time that they spend sleeping elongate by 30 or 45 minutes. But they should be connecting their nighttime REM cycles first before their daytime REM cycles. So practically what that means is many children should learn to sleep through the night first before they learn to take consistent scheduled naps during the day. So if you notice that your baby is elongating their daytime sleep first, that can be a clue that they're reverse cycling. And so you really want to get those babies exposed to natural daylight during the day and keep it nice and dark at night. The next real part of setting a great foundation of sleep for your newborn is setting what I call setting the scene. So you want to think about where your baby is sleeping and the environment that they are sleeping in. So most newborns are what we call in the 4th trimester, meaning they just got out of the uterus, and in the uterus they were exposed to sound and movement, and quite a bit of it. Actually, the uterus is quite loud. The umbilical artery passes just behind the uterus, and it makes a loud, high-pitched frequency noise, and we'll talk again about that later, but that noise actually sounds, when we record it on Doppler, a lot like the shushing sound that we often use to calm babies. And they're in water, and so they're moving constantly. So babies don't like to sleep in a quiet environment for the most part. They enjoy white noise and find it soothing. So when you're thinking about setting up their sleep environment, you want to make sure that you have some white noise available. Picking the type of white noise is important. So the white noise should be of low, constant frequency. So something, again, kind of like an airplane white noise type sound or a fan kind of type white noise sound. You don't want to use something like ocean sounds, which oscillates between high and low frequencies, or a very high frequency sound, which is that shushing sound all through sleep. The shushing sound is great for calming, but not great for maintaining sleep. 2, you want the room super dark. We just talked about that. So blackout curtains, another notorious source of light are things like baby cameras. They tend to have red light for night vision. You want to try to cover all of those up because they will stimulate your newborn's pineal gland and reduce melatonin production. Potentially the most important thing is actually the safety of where you're putting your child to sleep. So you want your baby on their back in a crib or bassinet with a firm mattress and a snug fitting bed sheet, nothing in the crib at all. These 3 precautions are to minimize the risk of sudden infant death syndrome or SIDS or suffocation. So these are the most important of the things that we're talking about. Often, I see parents ask me, is it okay to put my baby in something like a DockATot to take a nap? Even if you go to the DockATot website, they will say that it's not safe for sleep. There's a few reasons for that, but the biggest one is that newborns don't have great head control, and so if they roll to one side, they don't have the ability often to roll to the other and protect their breathing. And so it's really not a safe place for a baby to sleep, although, as parents, we all do things that out of desperation, when we're exhausted and tired, and one time you put your baby in a docket top and they slept great. And so I totally get it, but it's really not a safe sleep option for your child. So continuing with setting the environment, you want it dark, you want white noise, you want them in a safe place to sleep. You want the temperature between 68 and 72 degrees. Depends on the baby, but most babies prefer it on the colder side, closer to 68 degrees, and the humidity somewhere between 40 and 50%. So that is the sleep environment. But how do you actually get your baby to sleep? That's often the harder piece of this puzzle. So again, I want to move back and talk about how you soothe the baby and a newborn to sleep. And then I also want to talk about the newborn bedtime routine, or really this can carry out into childhood. And how to prime the brain for sleep. So let's talk about the bedtime routine first. I usually recommend starting a bedtime routine the day you come home from the hospital. This really has some evidence for improving sleep in children, decreasing sleep latency, and decreasing nocturnal awakenings. And it can be used not just in newborns, but at all children at any age. If you are seeing struggles with sleep, you want to start by implementing a really good, solid bedtime routine. And the importance of this is, again, really it is a clue to your child that it's time to go to bed. And when you repetitively do the same habits, you will often, A, strengthen your circadian rhythm, but B, prime the brain to let it know it's time to make some melatonin for sleepy time. So usually I recommend that you start off your bedtime routine with a calming warm bath. And then move on to PJs and diapering. Part of the PJs and diapering, I usually recommend a baby massage, and there's a few reasons for this. In the context of sleep, there is some evidence to show that newborn massages improves duration to fall asleep, time spent asleep again, and decrease nocturnal awakenings. It also improves parental and child bonding, reduces their anxiety and stress, has shown to reduce cortisol levels in both the parent giving the massage and the child receiving the massage. And lastly, there is some evidence that it does increase IQ. And so I think that there's very little harm to doing this, and there's potentially a lot of great benefits. So I usually recommend that you do incorporate that into your bedtime routine. After you have done the bath, the diaper, the PJs, and the baby massage, I usually recommend a little bit of a story time, even at the newborn age. Babies' brains are like sponges, and so starting to get that language stimulation early on is great. But this can be like a really short newborn book, a couple pages long, no more. Their attention span isn't more than a few minutes anyway, so keep it nice and short and sweet. And then move on to either, good night affirmations or a good night prayer, whatever works better for your family. And then the last thing I usually recommend is feeding, swaddling, and moving on to the 5 S's. So once you've fed your baby, especially if you're breastfeeding, there are hormones in breast milk, especially breast milk that is produced at night, that contains, again, hormones that make your child more asleep, like CCK and cystokinin. Both of those are hormones that induce sleepiness in children. So that's why I say leave breastfeeding kind of to the end of your routine, right before you swaddle and move on to the 5 S's, because that will help your baby fall asleep. And at this age, they're really too young to spoil them or create bad sleep associations. At this age, it's really just about helping them as much as you can, giving them as much support as you can to help them connect sleep cycles and mature on in their circadian rhythming. Okay, so now let's talk about what to do right before you're putting your baby down. So I strongly recommend using Dr. Harvey Karp's 5 S's. I think that there's a lot of anthropologic evidence behind them, and it kind of makes good sense, and it usually works for most kids. So the first S is swaddling. So we talked about in my previous episode, you want to have the hands down, legs nice and free. The reason for that, again, is because you need to have a little bit of hip motion to prevent hip dysplasia. But the reason to really swaddle is babies have a newborn primitive reflex called the moral reflex, which is where if they hear a loud noise or they get startled, they kind of go like this. And that startle reflex will often wake them up. So the whole point is to keep their hands down and prevent that from happening. I often get a lot of questions like, well, will having my baby's hands down prevent them from learning how to self-soothe? Usually my response to that is no, because at this age, again, they're not at the developmental standpoint where they're capable of self-soothing. If you want them to practice self-soothing techniques, I would recommend keeping their hands out definitely during the day, or even if you want to try naps without the swaddle, although usually I find it's not as even naps, you really need the swaddle to try to get them to get a good solid nap. Secondly, getting good sleep is potentially one of the most important aspects of allowing your child to have optimal brain development. And so I usually think, sleep is more important than having them be able to practice with their hands at night. Lastly, I say definitely leave their hands out during the day. You want to have their hands out. It's great sensory play, so try not to put mittens or anything on them. File the nails down and let them have at it while they're awake. Second S, we went over this again in our previous episode, but that is the side lying position. So you're going to have them kind of on the side in almost a football hold. This is an okay position to have them in while you're holding them, but you never want to put them down on their side. They should always be put down on their back to sleep. And you really need to do I should have said this at the beginning, but you really need to do the 5 S's in the specific order, because, for example, if you try to put a baby in a side lying position who is not swaddled, you will induce that startle reflex and wake them up, and they will probably start crying. So try to do it in this order. There's good reasons for it. The next S is the shushing again. So you want to make a shh, shh, shh type of sound. You can download an app that does this for you if you find it a little bit tiresome or you want to offload some of that work. But the theory behind this is that, again, you want to mimic the sound that the baby would have gotten used to in utero, which would be the sound of the umbilical artery. The fourth S, so you've got them swaddled, you've got them sidelined, you're shushing them. The next thing that you want to do is start to swing or give them some motion. Again, this is to try to mimic some of the movement that they would have gotten used to in utero. And then the last S is sucking. We'll go over this again briefly. So the last thing you want to do is put a pacifier in or do sucking with your finger, whichever you prefer. Some babies will never take to the pacifier, and that's okay. But if they do and it works, that's great. If you're finding that you're putting the pacifier out and it's immediately falling out, you can do some pacifier training, which is you gently put the pacifier in and you practice pulling it out and let the baby practice keeping it in their mouth. After doing this a few times, babies get pretty good about keeping it in their mouth. Some babies, like I said, never take the pacifier. Again, it can be a little bit actually hereditary. So if you or a family member really like to pacifier, there's more chance that your child will also enjoy the pacifier. I recommend waiting at least a week to introduce the pacifier if you are going to be breastfeeding, just to make sure that breastfeeding is really well established. Pacifier use early on in breastfeeding has been associated with decreased success to fully breastfeed. And part of the reason for that really is these 5 S's work so well at calming a baby. Sometimes it can calm a hungry baby and cause you to miss some hunger cues. And establishing your breast milk supply is really about making sure you're getting to the baby as often as you can during the first week to stimulate milk production. So that's why I say during the first week, if you're breastfeeding, forego the pacifier for at least the first week until your milk is well established. And then just kind of a note on the pacifier. So around 6 months, I usually see that most children are at a developmental standpoint where they should be sleeping really well on their own without any additional help. So without any rocking, shushing, sideline position or sucking. Really, they should just be in a great sleep environment with some white noise and falling asleep on their own. And so this is the point where I usually recommend removing the pacifier before the association is really strong, and because they're at the point where they really shouldn't need it anymore. So kind of another question I usually get about the 5 S's is, well, Dr. Rolnick, isn't all this shushing and swaying and assisting my baby to sleep? My grandma tells me that this is going to mean that they're never going to be able to sleep on their own, that I'm spoiling them and I'm not letting them, learn how to fall asleep on their own. So again, I just want to repeat this. There's no way to spoil a newborn at this age. They do not have the developmental capability to fall asleep on their own or to self-soothe, and they don't have the cognitive state yet to develop sleep associations. So there's really no way to spoil them. This is really just about helping them learn how to self-soothe, helping them learn how to fall asleep, and most importantly, helping them learn how to connect those sleep cycles and establish good, healthy sleep habits. So That being said, rock them until they feel calm, between naps at nighttime. If your baby wants to take a nap on you, if you want to do contact naps during the day, at this point, as long as you're awake and alert and you're not at risk of falling asleep, that's fine. Anything you can do to help your baby kind of connect these REM cycles at this point is totally fair game. You really don't have to worry about creating sleep associations until you're closer to the 4 to 6 month mark. And then I want to have a little special talk about those premature babies, especially NICU babies. So for premature babies, they actually spend more time sleeping than even full-term newborns. They spend more time in REM sleep than non-REM sleep, so they spend more time in that active sleep than newborn babies. But one important thing to note for parents especially is sometimes premature babies sleep very easily until they reach full term. And then they start to get a little bit more aware. And so sometimes you'll see that the baby is super easy to get to sleep in the beginning. They're sleeping all day and it's great. And then you kind of feel like you've hit a bump in the road or regression. But just know that's totally developmentally normal. And just stick to what you've been doing, which is a really good sleep routine. Stick to your 5 S's. And stick to making sure that your baby gets good light exposure during the day and it's dark at night. And then another kind of special note for the premature babies, and all babies actually in general for term or premature, also considering doing some skin-to-skin contact. It can help, again, reduce that cortisol and reduce the stress of your baby. It reduces cortisol levels in the parent, but it can also boost milk production. And so it's kind of got multiple reasons to kind of incorporate this into your soothing techniques. If you're noticing that you've gone through all the 5 S's, you're still not getting anywhere, try just unwrapping the baby, getting them completely naked or just in a diaper, and putting them skin to skin with you. So what can you kind of expect after you've done all of these things and you've set a great sleep foundation and now you're at the 2 or 3, 4 month mark of your child's life? So once you start to get towards the 3 month mark, you want to start looking for signs of your baby rolling over, so that once your baby starts to really roll, you want them out of the swaddle. So I recommend thinking about the transition out of the swaddle. There's a few options. 1, you can go move to a transitional swaddle. 2, you can start ahead of time and during naps, start moving one arm out of the swaddle. Or 3, you can just cold turkey it. So once your baby starts to roll, you can just take them out of the swaddle. So that usually happens again somewhere between the 3 and 4 month mark. At around 4 months, as I said before, your baby is going to be able to start learning some of these self-soothing techniques. So there's a few things I want you to really focus on. In the newborn period, you're focusing on setting the stage, creating a good routine, getting a good environment, and as I said, really learning the difference between active sleep and awake. Let's just take a moment to talk about that. So how do you really know the difference between when your child is in active sleep versus awake? So a child who is awake will start to cry stronger, more frequently, and get more and more distressed. A baby who is in active sleep, if you wait 5-10 minutes, they might fall back again into deep sleep. So I always recommend, regardless of what's going on, if your baby wakes up and cries or they open their eyes and they're moving around, give them 5 or 10 minutes and listen to them. If their cry is getting stronger, if they seem to be getting increasingly amounts of distress, obviously go pick them up and start to soothe them. Otherwise, just continue to listen to them and see if they fall back asleep, because they might just have been in active sleep. And this will really help you learn what your baby sounds like when they're in active sleep versus awake. So taking that 5 or 10 minutes from the very beginning, from the day you bring your baby home, is very important. Once you start to move into the 3 to 4 month mark, 4 to 5 month mark even, you want to start to let your baby practice a little bit of being awake when they're put down. So the next real move you want to make is to put them down slightly awake, but calm. So you might soothe them, do all the 5 S's, and put them down while their eyes are still open and they're still awake but sleepy, and let them practice that last couple minutes of falling asleep on their own. And usually I recommend starting that, again, somewhere around the 3 month mark, or you can start it even sooner if you want, as long as when your baby starts to cry and get distressed, you go and pick them up and soothe them again. Because again, you really can't expect a baby to be able to self-soothe until they're closer to 4 months. But you can certainly start practicing a little bit around the 2 to 3 month mark. The next thing you want to think about, again, when you're getting closer to the 4 month mark is, options for sleep training. If you want to sleep train, getting your baby out of the swaddle, and also think about where you want the baby to sleep. So the baby should be room sharing with you. The AP recommends it up until 6 months, but where they sleep might differ. So they might be getting big enough where you want to consider transitioning them out of their bassinet if they're in one and into a crib. So those are kind of the next big things to start thinking about in your child's sleep journey. So I hope you found this episode helpful. I think, one of the major reasons why I wanted to talk and do a little bit more talking about the newborn period in particular is, babies don't come with a manual. Previously, we would have been like 100, 150 years ago, we were in large family units, and a lot of us would have been exposed to many, many babies before we had our own. We would have been taking care of our cousins' babies and our sisters' babies, our brothers' babies. And now as our family units have gotten smaller as a society, a lot of us, the first time we're really having any contact with a baby at all is when we have our own baby. And so this is incredibly hard to do with the amount of experience that as a society we kind of now have as newborns. And I totally feel like I get it as parents. We get desperate and we just want sleep. If you're feeling that way, definitely reach out for help. Reach out for help anyway, because this newborn period is super challenging. Your pediatricians are a great source on what is normal sleep, healthy sleep habits, but also your family members and your friends are there to help support you. So I hope this information is a little bit helpful for you ahead of time, or if you're in the thick of it right now. But if you have any questions or comments for me, please leave them below. I'm happy to help.
Thank you for watching the Beehive Doc Talks with Dr. Blair Rolnick. For more episodes and her practice, visit BeKindPediatrics.com, and don't forget to subscribe for more parenting tips wherever you get your podcasts. This information is for educational purposes only. It is not medical advice. Always seek medical advice from a qualified physician.